Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to our Wednesday news conference for the latest in COVID-19 information and updates. Let me go ahead and introduce who is on our panel today. We're joined by Amarillo Mayor Ginger Nelson, City of Amarillo Public Health Director Casie Stoughton, Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center, Dr. Brian Weis, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Lamanteer, Chief Medical Officer, Dr. Weis, Chief Medical Officer for Northwest Texas Hospital, Dr. Lamanteer, Chief Medical Officer for BSA. Got that right. Dr. Rodney Gonzalez, Director of the Amarillo VA, and Jared Miller, City Manager for Amarillo. At this time, I'm going to turn it over to our panel for brief statements, and then we'll take messages from the media. We'll start with Amarillo Mayor Ginger Nelson.
Good morning, Amarillo. Well, we're several months into this worldwide pandemic now, and you might be like me, just kind of wondering, where are we in all of this? We've spent a lot of time talking about the specifics of how our city responded to COVID, and you hear us talk about that in every press conference that we have. I certainly appreciate my panelists. I want to say thank you to each of you. I know I do that off camera some, but I want to say it publicly. Amarillo, this is an amazing team of people who've been working both in front of the camera sometimes, but a lot behind the scenes so that our city can be moving in a unified way, whether it's multiple hospitals, the health department, city staff, working with the state, working with the feds. These are the folks that have been having those conversations and trying to think around corners for us, and they're doing an excellent job, and I really appreciate it. The main thing that I would tell you, I'm going to let them talk to you about hospital capacity and all of that, but the main thing that I would say to us is how important it is for us to wear a mask. Now that we have the blessing and the benefit of watching our numbers plateau, it is our responsibility individually to do what we can to keep those numbers level. The virus is so contagious. I hear story after story of, we went to a dinner party with 10 people and now 8 of those people have COVID. It is so contagious. If we will choose to wear a mask, then we're choosing to help the folks on this screen and the people that work with them every day at the hospital keep us at a plateaued level. That's what we're hoping for. And of course, we're hoping that we're saving lives. You don't know who that person is that won't recover from COVID, but because of choosing to wear a mask, I am hoping that my choice to do that will save a life, but will definitely help these folks here and the people that work in our hospitals and doctors' offices and on our front lines as first responders. It will make their jobs safer and easier too. The City Council has moved forward with implementing some help for small businesses to just to try and help you recover from the financial hit that you've taken due to COVID. There'll be 2 new programs rolling out in the next week for small businesses. One is for low to moderate income employers or businesses that employ low to moderate income people. And then the other will be citywide, no income restrictions necessarily on that, but for reimbursement for any supplies that you've purchased to address COVID needs, such as PPE or hand sanitizer, things like that. So please be watching the city's website for more information about those programs. But the City Council is not just focusing on COVID things. What are some other things that the City Council is working on? Well, this week we moved forward to form a unity committee in our city. We want to lean in to the conversations that are happening nationally about social justice, about equality, about race relations. I think I'm very proud of how our city is handling that, the way we're providing a safe space for people to have an opinion and express sometimes anger, many times sadness about the events that have been happening in our nation. I'm very pleased to see how our citizens are respecting and honoring and being grateful for our police force here in the city of Amarillo. But we want to lean into those conversations, so we'll be creating a committee that can help us continue the conversation even when maybe it's no longer in vogue in the national media. What we want are real results in our community. We want to be neighbors with each other. We want to create opportunities to better understand and see each other's perspectives, and that will be the purpose of this committee. We're also going to begin to hear the City Council have a lot of conversations in the next 30 days or so about the Civic Center project. It's been on hold. We pushed it to November to be on the November ballot. And now we need to really analyze whether going forward in November is the right course of action. So stay tuned for that, and we look forward to having your input about that. We're also working on a charter review. There are some things in our charter that need to be updated. So stay tuned for that. We have a committee working on that. It is the time of year where we're working on budget. And this year especially, there will be budget challenges due to the loss of revenue from COVID, the sales tax revenue, and also especially our hotel occupancy tax. In August, we'll be breaking ground on the Thompson Park pool. So we're excited to see final designs on that. And so I just wanted you to hear from your city council that yes, we are still focused on COVID and how we keep our city safe in a COVID world. But it's not the only thing we're working on. We're moving forward on other projects. We have a vision for exciting things that are happening in our city, and we're planning for a future. So we're doing COVID, but we're also doing other things too. And I wanted you to hear that from me this week. So that's all I have, Dave.
Thank you, Mayor. This time, let's now go to Casie Stoughton, Public Health Director for the City of Amarillo. Casie, how are you?
Good, Dave. Thank you. So as of yesterday, there were a total of 3,631 cases of COVID-19 reported in Potter and Randall counties, 2,798 cases in Potter County, and 760 cases in Randall County. We have a total of 2,179 recoveries and 45 deaths reported in our community. That leaves us with a total of 1,407 active cases. Each case is a unique individual. I think that's important to note. I'll let the hospitals talk about hospitalization data. Results from nursing homes continue to trickle in as staff and residents who may not have been available during the initial round of testing are tested. So far, we've tested a total of 2,309 individuals, including staff and residents in nursing homes. 93% of those test results are negative, 6.5% are positive, and 0.5% of those tests are still pending. There are 14 nursing homes in our community, and 12 of those nursing homes have COVID positives identified. For assisted living facilities and group homes, we've tested 1,010 residents and staff. So far, 97% of those test results have come back negative, 2.7% are positive, and 0.3 are pending. We do appreciate all of the work from the Amarillo Fire Department. We haven't received any additional lab results from the JBS testing, so we have 17% of the test results still pending from that mass testing there at JBS. Since March, Amarillo Public Health has been focused solely on COVID response. So our clinical services were closed to the public since March. Next week, on July 1st, we plan to open limited clinical services, including STD, TB, immunization, and refugee clinics. All of our clinics will be open at half capacity and will be available by same-day appointment. One parent will be welcome with each child, and adults and children who can wear a mask will be asked to wear a mask. If you wish to make an appointment, please call on July 1st at 378-6300. We hope that's become a very familiar phone number to you now. We'll begin taking appointments at 7:45 in the morning, and our team is looking forward to seeing our patients again. I think we're looking at some back-to-school immunizations. So if you haven't had your back-to-school immunizations, now would be the time to call and make those appointments. Since many churches have began opening, there have been reports of public health of exposures of COVID-19 at some of our local churches. There are a few simple actions that we can take to make moving about the community, including going to church, very safe. If you're sick or you've been recently tested for COVID, it's just not appropriate to attend church or any other location until you know the results of your test or until you're symptom-free for at least 3 days. It's best to keep at least 6 feet distance between yourself and your family and others, and please wear a mask. Masks, especially at church, can help slow the spread of COVID, as typically we spend at least an hour together singing and other activities. While there are currently no restrictions on how to have church, there are a few simple steps to make church a safer place to be. Currently, here in Amarillo, we do maintain our plateau of cases. However, we're watching the numbers closely as cases and hospitalizations due to COVID increase around the state. Here in Amarillo, we can change the course of the pandemic just by changing our behavior. We're at status level orange, so please use extreme caution when you're moving about. Wear a mask, stay 6 feet from others, and practice good hand washing. It's also okay to stay home as much as you can. Right now, it's as important as ever to be COVID aware. And that's all I have today, Dave.
Thank you, Casie. This time, let's now go to Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center. Dr. Milton, how are you? We can't hear you, Dr. Milton.
How about now?
We got you now. How are you?
Okay, well, good. Yes, I would like to say that Casie and Mayor Nelson have basically covered what I really wanted to say, which once again has to do with controlling the spread of this very contagious virus. That really involves wearing a mask and continuing to practice social distancing. I'm sure that everyone has been aware of what's been happening across other areas of the state and the nation, and how we're having increasing numbers of cases. And I think even today, I noticed that Texas has a record number of cases over the last 24 hours. I think all of this is due to the fact that people are out and about and not practicing social distancing as much as they should. Certainly in our community and in the Panhandle, every outbreak that we've had has been associated with individuals who have to congregate or choose to congregate, whether that be through a basketball game, through a packing plant, or through a correctional facility. So it's very clear, I think, how this tends to spread. And so everyone needs to keep in mind that it's a highly contagious, and COVID is going to be around. It's going to be around the rest of the summer. It's going to be around into the fall. And I think we just need to learn to adjust to that as best we can. In terms of the hospital and the use of remdesivir, I noticed that this morning that the governor is releasing more remdesivir to hospitals. We have plenty of remdesivir in our community. We're continuing to use that drug. And we also have instituted the use of dexamethasone, which is a steroid, an immunosuppressant steroid that has been around for a long time. And we've incorporated the use of that regularly into the use of remdesivir. So we're using those drugs usually on a dual basis. And we continue to see some patients in the hospital. I'll let Dr. Weis and Dr. Lamanteer comment more on how the hospitals are doing in capacity. And that's all I have, Dave.
Thank you, Dr. Milton. This time, let's go to Dr. Brian Weis, Chief Medical Officer for Northwest Texas Hospital. Dr. Weis, how are you?
I'm doing well. Hey, good morning from Northwest. So, with all this COVID craziness, I think it's been easy to overlook the fact that we are approaching July 1st. You say, what's significant about July 1st? So that is the beginning of the academic new year. So over the last month, we have graduated a number of senior residents, a number of senior students, and July 1st, we bring in a whole group of young people starting the next phase of their medical training. Now, when I started as an intern, I remember getting a white coat with my name on it, but I don't remember getting a matching mask with my initials on it. So it's kind of an interesting time for these young people to be starting their training. The reason I bring that up is we have a ton of people that done amazing stuff in this hospital, but today I want to particularly recognize the Texas Tech residents and their faculty. They have done an astounding job of taking care of the sickest of the sick at Northwest Texas Hospital. And I'd say even those residents who have been in their critical care rotations for the last 3 months, it's been exhausting. And yet they have done just a profound job of taking care of these very sick patients. So, the residents and Texas Tech are an invaluable resource to both hospitals. And I would say in Northwest Texas, we are particularly proud to be a teaching hospital in this community. We talked about things, the fact that things are moving back to normal at the hospital. So give you an example. So before the middle of March, our average daily census was about 240 plus patients in the acute care hospital. Then we hit the COVID crisis, and our numbers dropped into the 160s and 170s on a daily basis. And I know Dr. Lamanteer and I both talked about that precipitous drop in volume that both hospitals saw. Our census today is 239. So we're getting back to where we were as of mid-March. The great news is, even though we have more patients in the hospital, that does not include more COVID patients. So right now we are at 7 positives in Northwest, and there are 2 in the MICU, and only 1 of them is on a ventilator. So we're doing very well in terms of the number of COVID patients in the hospital right now. Overall, we have tested a total of 3,093 patients through Northwest. 363 of those are turn out to be positive. That's about 12% of our total testing that we've done. Amongst that, we have had 27 patients die with the COVID-related illness, and that's despite the best efforts of the residents and the doctors. So, as Casie pointed out, that's tragic, but 27 have died at the hospital. With regard to remdesivir, we have treated 24 patients at Northwest. Most of those received a 10-day course. We have the capacity to treat about another 15 patients with the supply that we have right now. Now, it's interesting, even though Amarillo has been looking pretty good with regard to COVID, we're still being affected by the outbreaks across the country. And many of you know, Universal Health Services, UHS, is our corporate entity. And we've been notified that some of our sister hospitals in Florida are getting in trouble. And so we may be sending ventilators and other equipment to Florida very soon here to help support those facilities that are really now in the midst of that need. And lastly, I just want to reiterate what Dr. Milton and Mayor Nelson said. We've had a couple doctors come and visit us in the last couple of weeks, and they've told me that on the flight from Dallas to Amarillo, they're on a full airplane. Everyone's supposed to be wearing a mask, and they notice that people are taking their mask off on that airplane. We know Dallas is a hotspot, and we know Houston's a hotspot, and it's absolutely critical. That is a very vulnerable situation to be on a full airplane and people are taking their masks off. So again, I ask the same thing the mayor does and Dr. Milton is, please be aware that we must protect each other. We have to wear a mask when we have to, particularly in an environment like a closed airplane, and protect each other, or else we're going to see this surge again. So thank you. That's all I have this morning.
Thank you, Dr. Weis. Now go to Dr. Michael Lamanteer, Chief Medical Officer for BSA. Dr. Lamanteer, how are you?
I'm good. Can you guys hear me well?
Yes, we can.
All right, very good. Good morning. Thank you for letting me join the teleconference today. I'll start off with some statistics for BSA in terms of where we are. We're at 10 patients confirmed in-house as of this morning. 6 of those patients are in our intensive care unit. 3 of those are on the ventilator. We have 4 patients on our general med-surg COVID unit. 10 patients confirmed in-house is the lowest number we've been at in terms of that confirmed census since April 16th, when I look back at my data today, that I've been keeping a log of since the beginning of this pandemic in Amarillo, which was back in March. So we have been on a gradual, steady decline at our hospital as well in terms of confirmed cases. With that being said, not been able to break down into the single digits as you have been aware based on the numbers we've been reporting. And certainly we anticipate there's going to be an ongoing number of cases in our community, throughout our state, throughout the nation, and we need to be prepared and remain prepared in terms of our surge plan and what we're doing to accommodate these patients. Our ICU capacity at this time is pretty high, but again, the majority of those patients are non-COVID individuals that we're managing. I share the same comments with Dr. Weis in terms of our overall hospital census, getting as close to our historical census as we've been since the beginning of the pandemic. We had 271 patients in-house yesterday. This is on the acute side, and we have 258 patients today in-house. So again, a very small number of those are COVID patients. However, we remain prepared to handle any future bolus that comes in. At this time, we have performed almost 4,000 tests for COVID since the beginning of the pandemic. About 18% of those tests overall have come back positive. The majority of those tests have been done on outpatients, not individuals admitted to the hospital. As far as individuals admitted to the hospital, that number is up to 244 since the beginning of the pandemic. So we've had a large experience managing COVID positive patients here at BSA. And again, our historical experience has been about 50% of those have required intensive care services. Our pre-admit testing protocol that we perform on patients coming for elective surgeries, we've done about 1,142 tests on those individuals. And that's based on individuals that are felt to be higher risk, or those that are having symptoms, or those that we're anticipating are a higher surgical risk, which means typically they're requiring an inpatient stay after their procedure. On those 1,142 patients, only 7 of those tests have come back positive. So we're comfortable that our protocol is an appropriate one. We feel like, again, any patient that comes in that's not meeting the protocol criteria, physicians have the autonomy to make a decision about whether they want their patient to be tested based on that individual's unique circumstances and potential exposures. And we think that is working well here at BSA. We've treated so far 11 patients with remdesivir, and this morning we're about to start a 12th patient on remdesivir. The majority of those patients have done very well. We've been using dexamethasone since early in this pandemic based on some literature review that our physicians wanted to proceed with based on some ARDS trials in terms of patients with similar respiratory complications and severe disease. Our staff has been highly committed to taking care of these patients that come to BSA with COVID-19. I can't be more proud of them in terms of everyone that is on the front lines managing these individuals, putting themselves at risk every day, having to wear the appropriate PPE, and then having to go back to their families at the end of the day, and certainly understanding what those risks are. I couldn't share Dr. Weis and Dr. Milton's thoughts more than to say that we must attempt to continue to abide by appropriate practices in our community, especially when we're in confined spaces. I mean, outdoors and when we're gathering, certainly social distancing is important. But when you're in those confined spaces, and an airplane is maybe the best example, you are putting yourself at risk if you're not wearing a mask. And that's just simple common sense in terms of that proximity, and even understanding that those places have filtration systems. We need to just take those precautions. We also need to be cautious when we're traveling in terms of avoiding large gatherings if possible, understanding that that's not possible in all circumstances. And again, I think that it's important for us to realize that preventative measures for this coming fall are going to be critical. Starting typically in the month of September, we start talking about flu vaccinations. It's critical for those individuals that are in a healthcare environment to be vaccinated. It's critical for those individuals that meet other criteria based on ACIP guidelines to get vaccinated, that they do so. Most everyone really should be getting a flu vaccine at this time. And for those of you that have not gotten a vaccine in the past and say that, well, I never get the flu, you need to get the flu vaccine, because the combination of the flu and potentially getting COVID-19 is going to put you at high risk for significant disease. So those areas where we have preventative measures potentially, not potentially, available, we need to take advantage of them. So again, I share everyone's thoughts here that we're happy where we are today in Amarillo with our case numbers not affecting the hospital significantly. We need to not be one of those cities that has a second surge, hopefully by our safe practices that we're abiding by in terms of preventing spread of this disease. And I also share Dr. Weis's thanks to the Texas Tech residents and faculty that manage patients in our facilities. They do an outstanding job. I also like to thank our BSA hospitalists, our intensivists, and every other physician managing patients here, all the nursing staff for their hard work. Thank you.
Thank you, Dr. Lamanteer. Now when I go Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
I'm doing well. Are you able to hear me?
Yes, we are. How are you?
Great. First of all, I want to say thank you to the mayor and City of Amarillo for giving me this opportunity to talk to not just our veterans, but the community. Here at the Amarillo VA, we continue to have 0 inpatients with COVID or PUIs. We do have 7 positive veterans that we are tracking, but they are at home on isolation. And we have 1 PUI that's also on home isolation. We are waiting for the test results. As mentioned, we do have several recoveries. We have 14 recoveries of patients we've been tracking. As I mentioned last week, our Lubbock VA clinic has been open since the 15th of June. Our Clovis, Childress, and Dalhart clinics opened on Monday, 22 June. They're only opening about a 25% capacity to see patients. And as we continue to monitor, we'll look to see at what points we can begin to increase that capacity. Now, our Amarillo main campus, we are currently tentatively planning for a 6th July reopening. We continue to watch what's going in the community, and as we continue to see this plateau, we are eagerly awaiting that opening. I did mention last week that we would be having a town hall. However, due to some date changes on my schedule, I've had to move the town hall to June 30th for our veterans. Once again, I didn't want to have that town hall at a time I could not be there, especially being the new director of the VA. So we've had to move that to June 30th. During that town hall, we'll be able to explain to our veterans our process for the returning to face-to-face appointments and getting back to what our new normal may be. And so with that, I do echo everyone, what they've said before me, the importance of staying vigilant, wearing the mask when out in the places where you either are not able to socially distance or when you're out with others. And important to protect those, not only yourself, but those around you. And so once again, thank you, Mayor Nelson and the City of Amarillo for this opportunity to speak.
Thank you, Dr. Gonzalez. Now we'll go to City Manager Jared Miller. Jared, how are you?
Doing good, Dave. Thank you. We remain under phase 3 of the reopening under the governor's executive order GA-26. In a news conference yesterday, Governor Abbott stated that COVID-19 is spreading at an unacceptable rate and it's got to be addressed. We can all do our part by following the safe protocols, which include staying home if you're sick, frequent hand washing, social distancing, and wearing a mask. Some of those things are really easy to do, and we can all do better at it, me included. Yesterday, the governor issued a proclamation to amend his executive order GA-26 to allow a local county judge or mayor in consultation with the local public health authority to impose additional restrictions to outdoor gatherings estimated to be in excess of 100 people. This was previously set to outdoor gatherings in excess of 500 people. We haven't had any of those restrictions in Potter or Randall counties to date. However, that is the change that was made yesterday by Governor Abbott. If you want more information on how Governor Abbott's working to open Texas back up, I encourage you to visit gov.texas.gov/open Texas, or you can contact the governor's office main switchboard at 512-463-2000. We also have a press release coming out later today to discuss a COVID business reimbursement program. The mayor touched on this earlier. The opportunity to apply for reimbursement of public health expenses, protective equipment due to COVID-19 is only available to businesses who meet the following criteria. Business has to be locally owned and within the city limits of Amarillo. Business was open prior to January 1st, 2020. Business has a physical location exclusively for commercial use. So for example, home-based businesses would not qualify. The business has no more than 50 employees. Restaurants and daycares are excluded from this requirement. Local franchisee can apply one time for all locations in Amarillo. The purchases that are being reimbursed have to have taken place between March 1st of 2020 and as late as December 31st of 2020. Like I said earlier, we have a press release and social media posts that are going to go out soon. And we're going to indicate the day and time of applications, that the applications will be posted on AmarilloAlerts.com. If you have any questions about the program, and I'm sure a lot of people will, call the Planning and Services Department with any questions at 378-6290. Dave, that's all I have.
Thank you, Jared. This time, we now want to open it up to questions from our media members. If you have a question for an individual panel member or the panel as a whole, that's perfectly fine. Let's go ahead and start with David Gay of Amarillo Globe News. David, how are you?
I'm good. Good morning, everybody. I guess my first question, there's been a lot of talk about masking today, and I know that some area businesses have required individuals going into their business to wear a mask, as well as Amarillo College passing a masking policy at last night's Board of Regents meeting. I mean, what are y'all's think that more businesses and entities should take that approach here in the Amarillo community?
David, can you repeat that question? We got cut off there just a little bit.
Oh, I'm sorry. I guess my internet connection is pretty shoddy. My question is, do you think many businesses and entities have instituted required masking policies, including many businesses, Amarillo College, and such? Do you think that more businesses and entities in the Amarillo area should take that approach to require masks for individuals to enter their facilities?
Casie, if you want to go, then I'll follow up.
So I think that, there are very few simple steps that we know that can prevent COVID. And so I think that it's certainly reassuring to know that businesses are taking that step. And I think it's appropriate especially if a private business wants to make sure that their customers are safe and their employees are safe to do so. And I'll certainly hand it off to the mayor to add to that.
No, I love it when the medical experts jump in and give the medical data, and then I can just jump in and give a people point of view. What we want is to live in a community that considers others before ourselves. And I think a policy like Amarillo College passed last night is doing just that. I don't think we as Americans appreciate living in a society where government directs your every action. Government tells you what job you can have, what kind of house you can live in, and oh, by the way, also you must wear a mask. We don't want government to be that involved in all our decisions. And government has to step in when there is a health crisis or some sort of emergency. Until that point, we as individuals hold the power to make those decisions, both for ourselves to protect our individual freedoms, but most importantly, to consider others around us. And that is the culture that we live in here in Amarillo, Texas. We stop when someone needs help on the side of the road. We offer if there's a death in the family or a surgery or something. We step in to meet those needs. And this is just a new need that we've never seen before. So I think you are seeing businesses respond by saying this is something different. But our analysis is that it's good for others if we implement a policy that expects our employees to wear a mask and expects our customers to wear a mask. I think it's a good policy. And I'm very grateful to see many of our businesses stepping up in leadership to set that policy out there. And I think it matches with our culture of who we are here in the Texas Panhandle.
David, I'd say certainly we support at the hospital. I mean, we're not even talking about reducing our mask wearing at the hospital. Now, I do know it's a little tricky for banks. People walking into a bank wearing a mask has not been seen in a positive light in the past, but I think overall, for most businesses, that would be a good thing.
Absolutely. Thank you so much. I guess, and the last question that I have is, with early voting starting on Monday, what is your message to the community about taking COVID-19 precautions when it comes to going to the polls, either for early voting or on the general election day for the runoff on the 14th?
Well, I think voting is one of those, just like Mayor Nelson was talking about in the last question, voting is one of those most sacred rights that we have as citizens. And so we should absolutely vote. We also know that there's some very simple steps that we can take to protect ourselves and those around us. And so if we'll wear masks, if we'll stay 6 feet apart, if we'll wash our hands, if we don't go, if we know that we're sick, if we go when we're well, those things that we know that we can do to keep ourselves safe and to keep those who we may be at the polls with safe, then I think it's voting is one of those civic duties that we have. That's again one of our most sacred rights, and so I think it's a wonderful thing that we get to do.
I will say, realistically, they're taking precautions at the polls. So just from a practical matter, there are people you can request to vote from your car if you have a compromised immune system and don't want to go in, but they are absolutely looking at how to set up the polls with social distancing, how to keep those stations sanitized. So I want to assure you as a voter that I do believe it is safe to come and vote if you are healthy. And if you are not having any symptoms, then I think it is safe to come and vote. And it's so important. Please get out and vote.
Absolutely. Sorry for the bad internet connection. Thank you so much. Have a great day, guys.
Thanks, David. This time, let's now go to Aaron Langston of KEMR Channel 4. Aaron, how are you?
I'm good. How are y'all?
Good.
First question. We are seeing an uptick in cases coming from the surrounding areas. Are we seeing any of those cases find their way into Amarillo hospitals?
No, not really. We're at least in Northwest, we've been staying 6 to 7 positives from there throughout the last 2 weeks. So we're not seeing any kind of surge from that.
I agree. Here at BSA, same answer. Really no effect here locally, at least yet, from outside case surges.
To us or not.
All righty. Well, I think that'll have me covered. Thank you.
Thank you, Aaron. This time, let's now go to Ariana Martinez of News Channel 10. How are you, Ariana?
Good morning. Thank you. This is probably for Casie. What demographic is contributing most to new cases?
So I think right now, all people. So, generally throughout this, and I know that's kind of a general answer, but we're seeing cases in each of the demographics. And so traditionally, we've seen our highest numbers of cases in the age groups 20 to 49. We know that those age groups kind of tend to be out and about a little bit more. And so we just really encourage folks to wear masks, to stay 6 feet apart. If you're sick, just stay home unless you need to seek medical care. All of those prevention tips that we've talked about so many times are just critical right now. The decisions that we make today will have an effect in the future. And so we appreciate our community doing those things. And so I think, those demographics that we're seeing are holding true.
And Casie, this one's probably for you too. Is the city able to keep current on contact tracing?
Absolutely. So, we have been very fortunate to have a lot of support from our city management, and we really appreciate that. And so we were able to ramp up our staffing as we needed to. And so we have about 37 staff members full time, and we increased our staffing to 90 at our fullest. And so we were able to stay current with all of our contact tracing. Now we're seeing new cases, we're seeing about 10 to 20 a day. And so we're absolutely able to stay current on those.
Perfect. And this one, I'm not sure who, but I'll just open it up. Will the contract with Physicians Preferred Laboratory increase the speed of test results?
So it can right now. So we're working with 2 different labs. we'll be working with, well, we will be working with 2 different labs. We've been working with a lab called CPL, and they've done a great job for us since March. We're not necessarily moving away from that lab. It's helpful to have multiple options when sending labs. And so PPL is a local lab. And so, and they are working with the Texas A&M Vet Lab to do that testing. And so it's important, I think, to not have all your chickens in one basket or your eggs in one basket or however the basket works. So we want to have multiple options to send our labs. And so, so I think that they're going to be a really great partner, and we're excited about that.
Perfect. That's all I have. Thanks, guys.
Thank you, Ariana. Let's now go to Paula Alberon of Telemundo Amarillo. Paula, how are you?
Good morning. Thank you. And you?
Very well, thank you.
Good. Okay, so my question will be for the mayor. Mayor, can you give us more information about the new civic center and the pool in Thompson Park?
Yes, so we have approved the bonds to have been issued so that the pool can be finalized in its design, and we really need to start construction on that sometime in August, and that's the timeline that we're on. Needs to be replaced, and we're looking forward to having that swimming pool open, hopefully Memorial Day of the summer 2021. We want to move forward with that as the plan, subject always to what's happening in the world with COVID and things like that. But we're very hopeful about being able to meet that deadline and being in a position with COVID where our city can have that amenity open and our kids can be swimming in city swimming pools next summer. With regard to the Civic Center, we had put on the May ballot, which we canceled that, postponed it to November, for citizens to approve a renovation and expansion project of our Civic Center. So many components there. Our Civic Center is 50 years old, and we have several users of our Civic Center that are looking at changing to other cities because our venue no longer meets their needs. It's an economic driver in our city, which is very important right now during our economic recession as caused by COVID. No one knows how long that's going to last, but what we do know is that we will come out of it, and what we can build to create leverage for our economy to help the Amarillo and the Panhandle area come out of it quicker. I think those are projects that we're interested in pursuing. The Civic Center project absolutely has an economic component to it, both with the construction. It would be a $300 million project roughly, and that would happen, over the next 3 years. So that would be a great infusion of capital into our local economy with workers and supplies and just having a construction project of that magnitude. But then we would have, I hope, a competitive advantage because we would be opening this facility hopefully at a time when our economy is completely stabilizing. And I just think that bodes well for where we are as a city in using it as a catalyst project to restart our local economy and help pull us out of a recession. Tourism dollars are something that I think we leave a lot of those on the table. And this council has been focused for the last 3 years in looking for ways to not just grow our workforce and our economy in the traditional ways, which we're very in favor of that, but what are some ways that we thought we weren't getting maximum potential out of? And tourism is one of those areas. So there's a lot to it and a lot of conversation that still needs to happen as the council begins having that conversation about whether or not to leave that on the November ballot and what that ballot proposition should look like.
Thank you, Mayor. And one more question for you. Last time that we talked, you mentioned that the city was thinking about having a group that create unity, especially between people of color. And do you have any update on that?
Yes, the council did approve conceptually creating a task force yesterday. And so what we will do now is each council member will submit a list of names with citizens that they think would be a great addition to that committee to bring a different perspective. And then the city manager and I will sit down and build that committee off of that the council members have provided. Our goal will definitely be to create a committee that reflects our community and lots of different perspectives. So we would like to balance it in gender and race and age and geographic location based on where they live in the city. And then Councilmember Frida Powell is working on a charge to that committee, what they need to think about, focus on, and try to accomplish in the next 90 days, in the next year, and maybe even as long as in the next 3 years. So the purpose of the committee, the broad purpose of it is to lean into the conversations, and let's be intentional about improving unity, race relations, equality, and justice in our city. And I think it'll be interesting to see what kind of conversations they can continue to promote in a positive and peaceful way across our city.
Definitely. Thank you very much, Mayor. Muchas gracias. And that's it. That was my last question, David.
Thank you, Paula.
Thank you, Paula. At this time, this concludes our news conference for today. Once again, we do these every Wednesday at 11 a.m. for the latest information in COVID updates and information for the Amarillo community. I want to thank all of our panelists for taking the time to provide this information to us today. Thank you, and we will see everybody next week. Thank you.
Thank you.
Thank you.